Colleagues and friends, hello and welcome. I am Abhijit Visaria and I'm the Technical Advisor on Population Dynamics for UNFPA in the Asia and the Pacific Regional Office based here in Bangkok. My fellow moderator for this session is Dr. Chalampol Chamchan. He is the Director of the Institute for Population and Social Research and Associate Professor at Mahidol University in Bangkok. Thank you very much for coming to the plenary session of the first sub-theme of PMAC 2026. So within the overall theme of PMAC 2026 on navigating global demographic transitions through innovative policy and equity-centered approach, our sub-theme focuses on the two critical aspects of social equity and population diversity. So at this plenary session, we would like to set the stage for this theme for the 5 parallel sessions that will follow and draw on the insights and expertise of our outstanding panelists here to explore how countries can navigate demographic transition through equity-centered, inclusive, and fiscally sustainable policy approaches, while also trying to ensure that diverse population subgroups benefit fairly within and across generations. So it's a big ask, undoubtedly. Let me begin by introducing our panelists in order. I'll keep my introductions brief so that we have more time to hear from them. And of course, more detailed biographies are available on the PMAC website. Also, frankly, this is such an illustrious panel that if I went into all of their accomplishments and impact, I will probably take up the hour. So I'll refrain from doing that. So let me start sort of from my right, Dr. Eduardo Banzon. He is the Director of the Health Practice Team under the Human and Social Development Sectors Group at the Asian Development Bank. Dr. Alexander Sasha Bodirosa, he is the Regional Director ad interim of UNFPA's Asia Pacific Regional Office. Dr. Gretchen Donhauer is a research specialist with the Center on the Economics and Demography of Aging at the University of California in Berkeley. Fadikemi Akinfadarin is the Chief Global Advocacy Officer at FOS Feminista. And last but not the least, of course, is Dr. Reiko Hayashi, the Director General of Japan's National Institute of Population and Social Security Research. So very briefly, the way that we'll do this, we'll have one opening question for each of the panelists. We'll then pose some cross-cutting questions and then invite different panelists to respond and also to discuss. So with that, over to my fellow moderator, Chalampol.
Thank you, Abhijit. I think for the opening questions, we can start from Dr. Alexander Sasha, that we would like to hear from you about the perspective of the UNFPA, why the social equity and population diversity essential for shaping the policy responses to demographic transition, especially in the Asia-Pacific regions. And also in the practical terms, how can the countries and development partners can operationalize this, maybe in the implementation and also the resource allocation? Over to you.
Thank you. Listen, I mean, when you're talking about demographic transition, most of the time you think first thought is basically that macro level. You're thinking about low fertility, urbanization, migration, and somehow quite often we forget that the real impact comes on the individual level, with the family, in the community. And that is basically what matters for us. And that's basically the reason why we are focusing so much for UNFPA on the issue of equity. If you really look on that level, I mean, you can look at just the gender and what is happening. In this region, women are 4 times more likely to care about family than men. That put them out of the formal work labor system and put them in the even more poverty. Then we are having today this new terminology. I mean, we are referring it to the sandwich generation, that shrinking working age generation. I mean, as we are aging, we are also structurally squeezing so that shrinking working age generation is care for both their children and their parents. And I can go on and on and on. For us, for UNFPA, it is a critical issue. It is a right-based imperative. If you are looking at our mandate, everything, the core of that is that everybody counts, that every person has right to health, right to well-being, right to opportunity across life cycle. Now, For your second part of your question, in terms of the very practical solution, the first one is data. We need better data. We cannot fix the problem if we don't see it. And when we are talking about disaggregated data, it's not only age and gender disaggregated, but also we have to look at the issue of disability and this area for disability, also wherever feasible for migration data, etc. We also have to look at the civil registration and vital statistics systems. They need to be improved. We have in this region alone millions of people who are not registered at the birth and when they die. If they are not on a paper when they were born, they are also not in the budget. And then we need also to invest more in a demographic foresight if you want. So that's the first segment. The second segment is a policy. Obviously, policy framework has to be much stronger. It has to be inclusive of the equity consideration from the very beginning and not as an afterthought. And then finally, resource allocation. Resource allocation, I mean, it is, I think the plenary before and then even the keynote address built a very strong case that investment across the life cycle does matter and yield financial benefits later.
Thank you. Asking Eduardo here, sort of thinking as countries are facing and trying to navigate demographic shifts, a key concern seems to be how do you keep sort of health and social protection systems fiscally sustainable but also equitable? So what are the kinds of policy approaches that governments should consider to meet these twin extremely difficult challenges?
Thanks, Abhijit, and I will probably enumerate a number of changes, policies or solutions that government can consider. First, with regards with healthcare workers, as we age, we need to empower nurses. In Asia, in lots of countries, nurses are not really empowered. And we're missing a great resource because they're actually a much more appropriate type of health workers that can handle and take care of the aging and children. Second, community health workers. We should move from treating them as volunteers, but really make them formalize and pay. As presented in the keynote, they are essentially not even paid informal workers, yet we expect them to do a lot of the things that we in healthcare services. With regards with primary care, Indonesia is integrating its primary care, great example, something countries could explore. But one thing which I appreciate WHO is doing, Western medicine is not really good in treating elderly care, doing elderly care. It's designed for acute care. Traditional medicine is more geared in addressing elderly care, and we should make traditional medicine more part of the systems and paid for in Asia and the Pacific. Sorry. With regards with health insurance, lots of work has been happening, the model in the region, Japan and Korea, two different approaches. But so we need to also get national insurance programs in Asia to expand coverage of population and services. We're not experts here, but we need to bring the pension people to start also to see how to make pension, social security, social assistance program more responsive. We should stop looking at hospitals as centers of disease, because essentially these are hubs. And Thailand is actually the best model, because in Thailand, the hospitals of Thailand also manage the primary care facilities. So if we start getting them to become hubs, the telemedicine and all of that, powerful resource we could use. We need to invest also in long-term care facilities, and I think we know all of them, from hospitals, primary care, community and child care. Finally, this is something my friend Sun Man Kwan loves to say, maybe we need to change the word UHC to UHCC, Universal Health Care and Coverage. Because UHC is so health, maybe we start looking at as universal health care and coverage. It sends the signal that we're also concerned with long-term care and others, in a sense, services, which promotes health, but not necessarily healthcare services.
Thank you. Thank you very much, Eduardo. Gretchen, something to sort of ask you to reflect on and perhaps tell us, sort of more about from a data perspective. So demographic changes are often sort of viewed very negatively, right? Or sort of the perspective around it seems to be all about population aging, sort of declining labor markets, the possibility of a population decline down the road. At the same time, we are also trying to sort of grasp at opportunities like the whole idea of a silver economy or the longevity economy, the population of perhaps some countries reaping the demographic dividend. From a data perspective or from an empirical perspective, sort of where do you think, how do we reconcile in some sense these two narratives? Do you have a sort of view on that? Thanks.
So in terms of achieving the silver dividend, the evidence base is still growing. Where sort of many countries are not there yet or in the early stages of this, and many countries haven't really made the kinds of investments and then had time pass where we could really evaluate. But where there is a good evidence base is sort of the effects of the first demographic dividend and which countries were sort of able to realize this or not. And I think there's some instructive parts of that narrative for this new phase. So the first demographic dividend, the change in population age distribution towards production, favoring production as opposed to consumption when fertility declines. So many countries went through that. Many countries were able to sort of use that to put themselves on a higher growth path for a long period of time. And other countries had the same demographic situation, but not as much benefit from that over time. So what are the difference between those countries? And I think there are three main differences that we can look at. So one is that many of the countries who realized a large dividend, many of the East Asian economies, Ireland, for example, had very globalist sort of integration economic plans, that they were using this enhanced productivity to go out into the world and have more global integration. So that's one difference. Another difference was how they sort of used that enhanced productivity to then invest in the next generation. So what sort of education and health investments did they make in their children? And some of the countries that had sort of more success realizing the dividend, their investments were sort of bottom up. They raised the floor, emphasized universal literacy, universal primary education. And then countries that had less success, there were more investments at the top, sort of taking students who were in universities and enhancing the universities, sort of pulling up the top of the pyramid, as opposed to kind of lifting the whole pyramid from the bottom. So that's the second one. And then the third is very connected to women's labor force participation. So as some of women's time was sort of freed up and having less childcare demand, what happened to that time? So the countries that were able to sort of transfer some of that time towards more market labor force engagement had more of a boost from these demographic changes. The countries whose sort of gender institutions, gender norms were a little more rigid, they didn't get to realize that benefit. And so what does this all mean for the silver dividend? I think first of all, it means that even though we are maybe in a period of sort of retreat from international engagement, that we're not powerless actors in that. We can try to continue that international engagement and get our governments to continue that international engagement that makes us all wealthier and contributes to sort of societal well-being. On the second part, the education, is that if we're going to invest in the silver dividend, let's do it from the bottom up. Let's invest in sort of the healthy aging for all persons, and this gets to sort of the equity angle. But I think that what the first demographic dividend shows is that you can get your finance minister to buy into this because it's a better economic strategy as well. It supports human rights, but it also has a higher return on investment. And then finally, the part about the gender dividend and being more flexible about sort of those norms and other institutions relates to the silver dividend, in that a lot of our ideas about what older persons' sort of roles should be are kind of also those old yesteryear sort of conception and institutions about what's proper. And so the more flexible our countries can be, the more they will win that future and win that silver dividend. So while I think the evidence base is still developing for how to achieve silver dividends, I think these past demographic dividends give us sort of some roadmap towards realizing those benefits.
Thank you, Gracians. I think now we can move to another important topics about inclusiveness, which I'd like to give questions to Fadekemi, that as we emphasize any adaptation or responses to demographic transition, it must be in the inclusive or equitable way. From your experience, what are the significant barriers still facing by women, marginalized group of the population, and also other groups of people who are at risk? And also, what needs to be shifted, both in terms of the public policy and also in some context that we have found that community-based approach can be one of the solutions that can ensure that all can fully benefit from the demographic and social change.
No, thank you so much for that question. Permit me to use gender as the example and the lens, because I do think a lot of the issues that we're seeing can also be extrapolated to other marginalized and systematically excluded groups. So, I mean, as has been shared here today, we know that demographic transitions are not gender neutral. Right? It actually creates pathways for women employment, empowerment, deepening inequalities, depending on what policies and programs are actually truly in place. So when we look at things like the demographic transitions from declining fertility to aging to urbanization, the reality is that women are affected distinctly, but also in unequal ways, because gender actually shapes the role in reproduction, in care work, and also in social power. So let me just give a few examples to kind of illustrate some of these barriers. So the first is around the issues related to fertility decline and the issues of women's autonomy, and particularly reproductive autonomy. There's a lot of public debates now about low fertility, often placing the responsibility on women, and framing women's educational choices, employment choices, as part of the cause of the demographic change, and particularly the fertility decline that we're seeing, versus focusing on the issues, the structural drivers, which is, you know, the economic insecurity, lack of childcare, weak social protections. But the reality is that these kind of narrative actually legitimize coercive pronatalist policies that can restrict women's autonomy and reproductive rights. And so really, we need to start to look at demographic change not as a problem, which we tend to see also in countries where you have more restrictive migration policies, but looking at it basically from the perspective that it's not a problem for women to fix, but to look at it in terms of how fertility decisions are made voluntarily. How do we have these policies to ensure access, particularly to comprehensive sexual and reproductive health services, and to reduce the real costs for the choices that women make. We need to shift that public narrative, in addition, at the community level, to make sure that we see this as a shared social responsibility that is essential for the demographic outcomes that we want. A second example that we could look at is around the issues related to population and aging care burdens and the gender inequality that comes from that. You know, as we know, rising care needs are primarily absorbed by women through unpaid care work or underpaid care work, reinforcing some of the gendered expectations and stereotypes that women in particular have to pay for, even though it should be actually covered by the public care system. At the same time, we know that women are living longer, and life expectancies, combined with like their work histories, increases the risk of old age poverty, especially when pensions and benefits are tied to formal employment. So to really sort of address this, we need to look at policies that shift and recognize care as an essential service. It's an investment, it's not a bill. We need to ensure that there are, social infrastructure, support for affordable elderly care, disability services, etc. And particularly at community level, we need to look at how do we continue to support local care systems and networks, supporting caregiver organizations, challenging norms that neutralize the contributions of women in terms of unpaid care work, so that we don't deepen these sort of gender inequalities. But I do have to say that, these dynamics, even though I'm talking about them in terms of the barriers faced by women, it also applies to other marginalized and excluded groups such as persons with disability, gender minorities, because we know that demographic transitions tend to be to amplify existing social inequalities. And so instead of creating new ones, so we need to make significant investments in these areas.
Thank you very much, Father Kemi, for addressing importance of thinking about the care system and gender inequality, because it's going to link to the next question that I will give to Lego, that as we have seen, the population aging has been transforming social structure and also the care arrangement in many countries. So we would like to hear from Lego, that maybe from Japan experience and maybe other countries from your research, that what can be the lesson that the world can draw out in strengthening the intergenerational support system and the care provisions, which at the same time can safeguard the equity.
Thank you, Charampon, and thank you, everybody. And thank you, PMAC, for inviting us all over to talk about this issue on demographic change. So yes, I'm going to answer for the care, how to do, and then what is happening in Japan. But before that, this opening ceremony and then also the previous panel, it was very interesting and inspiring in the way that, for example, Professor Takemi was saying that there is diplomatic vacuum. And then also, Professor Chris Murray was saying that population decline will start in 2060-something. We have been saying, because of the United Nations Population Division said it will start around 2080, but according to GBD, it is much earlier, and then I agree that it will be coming very soon. So now we are at the corner front, or we are at the changing point of the global society. And then maybe we are not in the era of international aid, but we now have to shift thinking about not aid, but to think about the betterment of human population at large. So having said that, yes, now the population is aging, and 29% of Japanese population is over 65 years and older. It never go up because we are now having a lot of international migration. Maybe this issue might be open later. But anyway, we have started this long-term care public insurance in 2000. And at the time, yes, we have made a change to restructure the care system, which is rather not a medical technology care, but to the more care for caring people with disability, that means the older people. And so we have to change many things. But then the first thing we have done is that before that, it was family who were taking care of older persons. So we wanted to put it in the social sphere. And then so there are a big change since 2000. But first thing I have to say is that still the family is the main caregiver. But this main caregiver has changed. Because of the system, there are more men, more sons who are taking care of the parents. And also older persons are taking care of older persons. 70-year-old daughter or son is taking care of 90 or 100-year-old father or mother. However, I'm not very pessimistic about this issue because it is sometimes good. And then 70 years old right now is very healthy. So and then they are happy, they retired, now they have time to take care of their parents. So we always have to adapt to the new demographic reality that young 70 taking care of, 100 parent and so on and so forth. The second thing is that yes, we have changed to the social sphere, so we have made a new system, and then we need the professionals. So now there have been a kind of bamboo growing number of university department who forms the nurses and then also certified care workers. So always there is a new innovation for development of this technology of care, and then also this kind of how to care. There is a kind of technique and technology and science we have to share each other. And then maybe my time is limited. I just mentioned about AI and DX. Yes, Professor Chris Murray said that it is a threat, but then I was happy to hear that another person, she was talking about we had to be cautiously optimistic. So far, we have many kind of technology, like it can be from the fake cat to the sweeping robot. And so there are many kinds of technologies which can enhance and also support the human professionals and carers. So there are many things which we can collaborate with this AI and DX. But the only threat we have is that people using AI, I see on the floor that people are walking always in front of, they are walking with a smartphone. So that is changing human relationship. People are no more talking face to face. So maybe that is the reason why there is a global fertility decline since 2015. But anyway, how to rethink about human relationship in the time of AI and DX, that is one of the challenges. So maybe I should stop here.
No, thank you, Rika. That was very interesting. I think one of the things that I often think about is that when we say AI, I think 95% of us are thinking about generative AI, right? And of that 95%, I think 99% are thinking about ChatGPT. Right? We're not even thinking Gemini that much. But I think where, Christopher Murray's presentation was very interesting is that he actually linked AI with the threat of bioterrorism, right? And sort of, I think that's a whole sort of area to also think about. But your mention about sort of AI and technology in particular, sort of, I'd like to sort of invite reflections from the panel on the role of the private sector in some sense. Eduardo, perhaps you could kick us off on this, which is, can the private sector be held to the standards of inclusion and equity in helping sort of countries, societies, economies navigate demographic transitions? And so if so or if not, how does one engage with the private sector? We often seem to be putting a lot of emphasis on public systems and public institutions, but they're ever present and ever growing. So do we hold them to these standards, and how do we engage with them?
So I think one way to look at it is the private sector, of course, is a very heterogeneous group, and there are parts of the private, there are different ways in which you engage them. So private healthcare provider, we have done a great job. Well, we know how to engage them in the health side. If you have a strong payer system, you're comfortable to bring them in Japan. Your providers are private. And then if a country has good regulatory capacity, it actually knows how to regulate and deal with contracts. So in a sense, that's the solution with private providers. You try to get them to provide the services that you want, including, of course, long-term care or care for the youths, but in a way not in an unregulated parallel universe, which is unfortunately the way it is in a lot of countries. So the challenge there is strengthen your payer, strengthen your regulation, and get the information. You get to know them. But there's also a part of the private sector which is the innovative, in the sense that when we talk about AI, and I'm not afraid of AI and health, first nobody understands what the word is and actually hate the word. But nonetheless, it's essentially, I only look at AI as a tool to help us. And if there's one area that could help in long-term care, it's diagnostics. I'm a medical doctor, my friends, when I was young, my grandmother would always ask me to get their blood pressure, right? After a while, I hate it, right? Why do I keep on getting there? And I was using, of course, the Enero type. But now, the AI diagnostic has moved to the point, and with AI, that you could actually have it done so seamlessly. And you could just imagine how it could simplify your monitoring of the health of the elderly. And we can even go to other diagnostics. So even in diagnostic itself, if AI digital will be game changing. One of the things I always look at with LTC is that one of the things that a lot of elderly people are looking for is people to talk to. We always have this story that in emergency rooms, lots of old people come, not because they're sick, but because they need somebody to talk to. Telemedicine would transform that, because even if they're not talking face-to-face, they could actually talk to somebody. So we should move away from looking at telemedicine as for acute intervention. It's happening, of course, in other countries, but actually make it much more really, and in a sense, these are things the private sector can do a good job. And so we should start harnessing the private sector to go into that. So, of course, there is also a part of the private sector is the evil empires, but the part of government's job is to always make sure that you could get this part of the private sector to behave. But private sector should be seen heterogeneously. They should be seen as something we should harness. They will always try to make money, but doesn't mean that they're evil empires.
Fedekemi, any sort of thoughts on this, and particularly perhaps in your work, whether or how you've sort of engaged or advocated with the private sector?
Yeah, no, I was just thinking even in terms of like what role they have as well in terms of providing the necessary data to be able to complement the work that governments are doing. The challenge is, as was rightly said by the previous speaker, there's sometimes the process where they work in parallel to governments. And that in itself can lead to some fractures in the system. And we need to look at how they're contributing, not just in terms of innovation and experience and new ideas, but also in terms of bringing this data closer and integrated within the government system so that planning can actually really take place in a systematic way. I do believe that there is also the importance of thinking about frameworks that also help to regulate, because as we're exploring the issue of technology and private sector advancing on this, we should also not forget that there's also biases in some of these things and how that plays out in terms of the way we look at the information that we're looking at in terms of the way services are delivered using these technologies. And I think there's a lot of research and a lot of new evidence being generated about the gender biases in particular around some of the new technologies that are emerging. And so I think there is a need to think about the necessary frameworks and regulatory frameworks that can be put in place to be able to support and to minimize these biases, especially as it relates to systematically excluded communities in the process. And from where we work, that's been one of the things we've been advocating for as well, to recognize the potential, but to also recognize the risk and to put frameworks in place to minimize those risks so that at the end of the day, the outcomes we're looking for can be achieved.
Thank you very much. We'd like to move to another topics about intergenerational solidarities, which we observe that in the context of many aged society or even aging society, this term has increasingly become important themes to discuss, which we would like probably to hear from Sasha first, that talking about the responsibility, share for enhancing this to happen, intergenerational relationship between the governments, between the community, civil societies. How do you think about that? What should be the key roles in working together? How?
Yeah, thanks a lot. Allow me to frame it a little bit differently. I will come to and respond to your question. But, for me, when thinking about intergenerational solidarity, usually three things come to my mind. Conceptual aspects, behavioral, and then that basically policy, institutional aspects. behavioral, even if I try to scan this room, and here I'm talking about divide. Usually when I'm in a meetings, I'm always fascinating that there is, in some places, gender divide, but I'm also noticing as I'm getting closer to my retirement age, that generational divide. Even here, if you really just quickly scan, you will see that there is probably a little bit more concentration of younger generation on that corner over there. And that's pretty much universal wherever you go. And not that long ago, if you agree with me that 30 years is not that long ago, I used to be Secretary General of this incredible youth organization, International Federation of Medical Students Association. And they are one of organizers. I was so happy to learn that this morning. But I remember clearly in that role, we were doing different projects, and they came with this concept that back then was so alien to me, intergenerational dialogue. And I'm almost ashamed that back then I didn't see any value in focusing on discussing it. That was not a big issue, at least not for us. We were just aspiring students, future doctors, and whatever. So there is, that ageism is there. And I'm thinking, when I'm talking about behavioral aspects of that, is also thinking when we talk about intergenerational dialogue, when we talk about intergenerational solidarity, how do we address that? I wouldn't go that far to talk about, trust deficit. Basically generational, I don't know how to frame it, but it's there, like it or not. Now, having said that, there are so many incredible movements right now, and we also heard this morning at the keynote speech, and so many incredible initiatives. They're basically trying to bridge that divide. And that's super encouraging. Part of that, you mentioned government. Obviously, part of that is first, for all governments, is aspirational, right? To have that solidarity. We need a policy framework, but we also need institutional architecture put in place. The core, and I think that the key question here, how do we put that concept of intergenerational solidarity into very practical terms and actions? And probably it can be anchored in the community and the civil society organizations. They are the ones that are already providing solutions. They are the ones that are giving us an idea what are those practical solutions to address the issue. And private sector, by all means, has an important role, and most prominently we talk about that artificial intelligence, digitalization, how to prevent that digital divide when it's come to the generation, and finally family. And family is a bedrock of everything, if you want, but we shouldn't leave that up to the family. We need a framework, we need a structure, and we need to support. We cannot just build everything on assumptions that because of the cultural context that the family is the one taking care of the elderly population. Let me stop here.
Thank you very much for sharing that, which I'm not sure we can hear from Lego more on this issue. Thanks.
Thank you very much, because intergenerational solidarity is something like, it's becoming like a war in Japan, because you see, we have been spending a lot of money for older person, and then now, aging, even there is no, older people is not increasing anymore because total population is declining, but now the issue is low fertility. And then some young parents started to say that, well, there is a subsidy for diaper for older person, but no subsidy for baby diaper. Why? Then, so there is this pressure that the money should be allocated not only for the elderly, but also for younger couple and for children, and then also just to promote the family policy. I think it's not only the case of Japan, all over the world, or maybe, in Africa it's a bit different, but this changing demographic shift, especially low fertility issue, is going to change whole picture. And then we have to think about different, and then also political power. Older person go to the vote, and they have more power for the voting, so they have more, and so on and so forth. So now we are really in the good position to talk about intergenerational solidarity. And then also another thing I would like to say is that recently I was shocked to see the data on poverty rate among older persons and total population. In Japan, of course, poverty rate in of older person is higher compared to the total population, but I was looking into the data of World Bank's living arrangement and survey, microdata, then actually it is for the data of Senegal, older persons' poverty rate is lower compared to the total population. That means that those successful people who can survive to become the older person. Then in that case, we have to think about middle-aged men and women, how they can be healthy so that they can become the older person. So there is whole kinds of the cross-generational issues going around at this stage.
Yeah.
So
That's about a generational divide that's mentioned by Sasha as well.
Gretchen, I wanted to ask you, do you have any thoughts on measurement here, or sort of, or assessing, for example, intergenerational solidarity? It seems to be a sort of fairly complex phenomenon or a factor to measure. Sort of any thoughts from research and
Yeah. Well, there's an old saw, I don't know who said it first, but we value what we measure and we measure what we value. And so there's definite feedback in gathering data on something and publicizing it. I mean, this is definitely related to the intergenerational linkages. You know, projects that I work on, we try to understand the transfer systems, both in terms of market goods and resources, and then unpaid care resources, time transfers. And our goal in that data is certainly for policy so that it's available to policymakers to make the best policy, but it's also about ideational change. So when people realize, oh yeah, my pay-as-you-go pension system is funded by younger persons, you know, and making sure that that data is out there, and also that there is, you know, this level of time transfer that's actually going from older persons to care for grandchildren or to care for an aging spouse. Making sure that data is out there can sort of counteract narratives of sort of just strict dependency as sort of the state of older persons. So I think that as researchers, that is one of the most valuable things we can do, not necessarily sort of putting forth policies ourselves in political systems, but making sure that good information is out there so that it can give us an opportunity to have those conversations.
Thank you. We'd like to open up the floor for questions or comments from members of the audience. Would anyone like to pose anything to our panelists? If so, please come up to the mics that are in the 3 aisles here. Yes, Aris, go ahead. Would you like to introduce it? Yeah, thank you.
Aris Ananta, Universitas Indonesia and University Brunei Darussalam. Plenary 1 talking about demographic transition, social equity, and population diversity. What can we conclude about the relationship between the 3 variables? Thank you.
Sorry, Aris, could you repeat? Sorry. Relationship between the?
I need to help to conclude what are the relationship between the 3 variables: demographic transition, social equity, and population diversity. How does demographic transition affect social equity and population diversity? Thank you.
Anyone? Yes,
Start?
please go ahead.
I mean, I would say in the first phase that it can create more pressure in the system. If when we're talking about declining population growth rates, something that as a globe we haven't really encountered before, that it can sort of create a scarcity context where we're fighting each other for scarce resources, for what is perceived as ever more scarce resources. But there is a lot of evidence that that's exactly the wrong way to think about it, that cooperation is a better, more higher return strategy than competition. I mean, you don't want to completely go one way or the other, but that there is plenty of reason to argue that diversity and broad investments are a higher return strategy to get sort of away from scarcity.
Would anybody like to add anything? Okay, yes, Ritu, please.
Yeah, thank you. I'm Ritu Sadana. I'm the head of WHO Secretariat for the UN Decade of Healthy Aging. I'd like to connect the previous plenary to the very interesting discussion in this plenary. Unhealthy aging was recognized as one of the 17 important threats to think about. I think we have an opportunity for healthy aging. Picking up on what Alexander Sasha Buderoza mentioned, that investments across the life course matter. My question is, how can we, as we are designing, or we'd like to have inputs into this new global architecture, a stronger systematic approach to include the issues of healthy aging, or on one hand you could say unhealthy aging, because if we look at it, I'm saying it as the lead for the UN decade, I think our response collectively has been rather tepid. In SDGs, there's not one indicator, measurement matters, that's specific to older persons' health. In fact, the one that could have been NCDs stops at age 69. DHA, which was mentioned in the last presentation, primarily focuses on the first half of life when you look at the flow of funds. And maybe there will be much less flow of funds, but we have a mismatch in relation to the burden of disease, particularly in older people. So my question is, if we really want to have healthy aging as a systematic strengthening, what would be one important thing that we could do to increase the systems approach to support it? We have some ideas at WHO, but most of the efforts still go to maternal and child health. We have norms and standards, but most of the investments from the development banks still go to maternal and child health or other issues. So you can hear it's a plea, because we have some of the tools. There's a huge demand from countries, not only in this region. So thank you very much for the discussion.
Yeah, Edward, please.
Okay, part of the problem is that at the country level, there's really, in most countries in Asia, healthy aging is split in so many ministries, right? And so, because health, for example, is focused on health, and they have champions in health and maternity, so that's why you have maternal and child health. Social welfare looks into differently, and so I think that what we have been missing is convening all of this, whether putting, and the solution of having new ministries would not be the way to go, because a lot of the things that needs to be done are already being done by other ministries. So getting them to sit down, I think, how Thailand did UC, where they actually convened all the players. UC in Thailand is not a health story; it's a story of the triangle, right? So maybe this is where we need to do triangles now for healthy aging, getting all of the players, commissions. Now, once the country level starts having that discussion, then that's when the development banks responds. We do maternal and child health because that's what government asks us to support. So you need really to work at the government level. Would having benchmarks or norms from WHO solve it? Maybe not, because even if you do that, when this goes down to the country, who will do the job? If you don't have a clear, if it's just a small office in the Ministry of Health, that will be swamped by other things.
And if I can add, I mean, that's an excellent question. And I think part of that is, how do we advocate and make sure that it is focus of our discussion at all time. Unfortunately, even if you look across the sector, I mean, when even to mobilize resources for healthy aging investment across the life cycle, it's very difficult because it is a long-term investment. You don't see the results immediately. It is, when it comes to the donors, it's more challenging to explain to taxpayer what are the returns. So I'm afraid that right now that is not a appealing area for, at least if we are talking about donors. For investment, and that is pretty much linked, where WHO, UNFPA, UNICEF, and others are putting, their funding. They are more immediate concern. But on a positive side, I mean, I think you will agree with me that we never talk more about aging and healthy aging than right now. And this conference alone, you will remember you also attended some of events with the ASEAN. ASEAN is putting that as a focus. So I feel that there is a global movement that the entire world, the entire community realizing that is important aspects and that is critical investment. So my hope is that it's going to change very, very soon.
Because I'm sitting with UNFPA, and if you look at population, it's the same problem it has like aging years ago. So, maybe it's so tempting to say we create a UNFPA or a UNAIDS version for aging. Maybe that could be, I know it's against what's happening, with all of the trends right now, but maybe that at the global level, that may just be the solution. Just to drive and make it a priority.
Frederick, please.
No, I'm putting my African hat here. I think as Gretchen said, I think some of these issues are new to us. And I think there is a benefit of being a bit further behind because there's a lot of experiences we can learn from this region in particular. But I think we need to also put this into the fiscal context as well. We're asking governments to make investments in the long term. When you have democratic cycles that are 4 years and 5 years. And people are not looking, many of the governments are not looking too far. They're looking at the things that will, one, get them reelected, but will, two, can solve the loudest voice, like the needs from the loudest voice. And in the context of Africa, it's a bulging youth population in this moment in time. It's quite ironic because many of the leaders are in the aging population when you think about it. And they're not necessarily thinking about what this means. But it's this trade-off and challenge between the limited resources that are available and where do you make the best investments. And sometimes we know in our context, long-term planning is not always prioritized for many of these countries and wanting to solve immediate solutions that present themselves. But it's a little bit of like, cutting your nose to spite your face, if you think about it. So we do definitely have to continue to advocate. And I think maybe the closest entry point is to make sure that we're truly taking that life cycle approach so that there is at least a little bit of the foot on the gas, even if we're not going fully fast, but that there's attention being paid to the issues of aging. And I say there was a lot of humility because I started my work in terms of the youth sort of movement, just like you did. And so it's a trade-off, and we need to continue to push for that advocacy.
So just this question, there is the limited resources to allocate it for older active aging or aging issue. Yes, maybe it is true because when you get richer, your population becomes older. And then at that stage, maybe, well, the previous panel talked about vacuum, of diplomatic vacuum, and then also just shifting international aid system. So now we are changing, so we have to mobilize the country resources together with NGOs and all the civil society participation. For example, in ASEAN countries, they have created their own ASEAN Center for Active Aging and Innovation. And then each country is trying so much efforts to putting their own resources to develop the system. So maybe we are this activities for active aging is itself the sign of we are moving to the new world and then the new international collaboration period, and so on and so forth. So I just want to mention that aging is a good turning point. It's a good thing to show us the turning point. Yes.
Thank you. I think there was a speaker there who has perhaps yielded time. So maybe Poonam for the last question.
So I'm Poonam Mutreja from Population Foundation of India. I am so happy at this conference and in other spaces we are focusing on aging, or what was called the silver dividend by Abhijit, and UNFPA has very nicely brought that out. So, but what about, I want to add to that the gender dividend, which I think we need to pay a little more attention to along with aging. And as women have fewer children, we all know as fertility declines, women are going to be having more time for work outside, and perhaps paid cared economy is something for the women we focus. But my question is, at the same time, for gender justice and reproductive justice, we as a global community have to deal with the whole issue of the pro-natalist policies or programs, which was mentioned, I think, by one of the panel, yes, you. I am very worried how this is going to impact reproductive justice and the call for highest political leadership, whether it is in Moscow or Korea or China and now increasingly India, where women are seen as switches to put on and off for fertility. And women, you know, there's almost a gun on the womb of a woman to have more children because of very unreasonable issues, including in Russia. It was said that women must have more children because not only we have an aging society, but because they have soldiers going to war. So I think we need to get a little more assertive on responding. And finally, in a resource-poor situation where governments have greater burden with low-income countries, can we not have a scale-up of the pilots or strategies that have worked in Japan and other countries? And because there are so many of you from UNFPA here and global community, can we do a sort of framework or a blueprint? Thank you.
Sasha, do you want to take it?
Just quickly, listen, you just open an entire new topic. And probably, I mean, I'm not going to give any justice to nobody here. That requires what you just put on the table is critically important. I can tell you that more increasingly, I'm just now looking and thinking of past 2 years of my engagement on the policy level, and I see more and more desperation, if you want. And with desperation, unconventional ideas are coming. I'm very much disturbed that in the narrative, in public narrative, women are sometimes treated as baby factories. We are very much disturbed to learn some ideas on very fast fixes to the low fertility rate, including revision and revisiting the legal age of marriage. We are very much disturbed to learn from some, prominent speakers, religious clerics, arguments that, quote unquote, if the girl is married at the age of 14, she doesn't have a deciding power. She will likely have at least 3 kids before the age of 18, so our problems will be solved. So now it's a time to act. And I totally agree with you. I mean, it has to be unified front. It has to be probably the subject of some other gathering, because we need to advocate and be on alert more than ever. There are valid concerns that are fiscal concerns, but what is problematic here, some of the solutions that you already mentioned are basically quick fixes that are in totally opposite side of everything that we are trying to do, an opposite side of the key aspects and elements of human rights.
I think, would anybody want the final word? Reiko, yes.
maybe I hope everybody have the rights to talk at the end. But yes, there is this pro-natalistic policies, but it's not only the fertility issue, also for migration. There are so many conservative people coming in, and then we are as if we are going through the same history path 100 years ago, and then which have led to that catastrophic global war. However, as years go by, people forget about it. And then I think that now this is the time that it's been 80 years since the last war, and the people, young people does not know, and then people are forgetting about it. And then for this issue, we, the people gathered here, I think that we all share the same value, and then we always have to be keeping in mind that there are the people of that different 100 years ago mind still there, and they're surging up, and for that we have to unite and how can I say, talk each other.
So on that note of a call for unity and more dialogue, I think let me call this session to an end. Colleagues, friends, please give a round of applause to our panelists. Thank you very much for staying. Sorry for cutting into your break. But we took the hour that we were given, so thank you.